If you've noticed your elderly parent or even yourself suddenly struggling to remember simple words, feeling pins and needles in their feet, or noticing a strange paleness to their skin, you might be witnessing one of the most underdiagnosed nutritional deficiencies in seniors today. Vitamin B12 deficiency doesn't just make you tired. It can silently damage your nervous system, weaken your bones, and even mimic the early signs of dementia. In this video, you'll discover 10 visible signs of B12 deficiency that you can check yourself right at home without any medical equipment. But here's the good news. Your body is remarkably resilient. When you catch B12 deficiency early and address it properly, your nervous system can heal, your energy can return, and many of these symptoms can completely reverse. So what causes vitamin B12 deficiency in the first place? As we age, our stomach produces less acid, which makes it harder to extract B12 from food. Certain medications like metformin for diabetes or proton pump inhibitors for acid reflux can block B12 absorption. Vegetarian or vegan diets, digestive disorders like Crohn's disease or celiac disease, and even a history of stomach surgery can all contribute to this dangerous deficiency. The challenge is that B12 deficiency develops slowly, over months or even years. So by the time symptoms appear, your stores may already be critically low. Stay with me until the end, because after we explore these 10 warning signs, I'll share 4 powerful natural ways to restore your B12 levels, protect your nervous system, and regain the vitality you thought was gone forever. Let's begin with the first sign. One of the earliest visible signs of B12 deficiency is a condition called glossitis, where your tongue becomes inflamed, smooth, and often painful. You might notice that the normal bumps on your tongue, called papillae, have disappeared, giving it a shiny, flat appearance. The tongue may also appear bright red or even beef-like in color, and you might experience a burning sensation or difficulty tasting food properly. Why does this happen? Vitamin B12 is essential for the rapid cell division that occurs in your tongue's surface tissues. Your tongue cells regenerate constantly, and without adequate B12I, this process breaks down. The papillae atrophy. Inflammation sets in, and your tongue loses its normal texture and function. Interestingly, this same process can affect your entire digestive tract, leading to difficulty swallowing and poor nutrient absorption, which creates a vicious cycle. Researchers have discovered that up to 50% of people with B12 deficiency will develop glossitis, making it one of the most reliable early warning signs. If you notice these changes in your tongue, especially if accompanied by mouth sores or a burning sensation, it's time to get your B12 levels checked immediately. Take a close look at the skin on your palms, face, or the inside of your lower eyelids. Do you notice an unusual paleness, almost a washed-out appearance? Or perhaps a slight yellow tinge to the skin and the whites of the eyes? Both of these visible changes can indicate B12 deficiency, and they're telling you something critical about your blood. Vitamin B12 is absolutely essential for red blood cell production in your bone marrow. Without enough B12I, your body produces abnormally large, fragile red blood cells that break apart easily. This condition, called megaloblastic anemia, means you don't have enough healthy red blood cells to carry oxygen throughout your body. The paleness you see is simply a lack of these oxygen-carrying cells near the skin's surface. But why the yellow tinge? Due to the breakdown of this protective coating, you may experience not just numbness and tingling, but also weakness difficulty, with fine motor skills like buttoning shirts or picking up small objects and problems with balance and coordination. This nerve damage can progress to something called peripheral neuropathy, which if left untreated, can become permanent. Researchers discovered that once nerve damage reaches a certain threshold, it may not fully reverse, even with B12 supplementation. This makes early detection absolutely critical. If you're experiencing these neurological symptoms, especially if you're over 60, take certain medications, or follow a plant-based diet, you need to get your B12 levels tested immediately. This is a serious sign that should never be ignored. Have you noticed yourself or a loved one, walking more slowly, shuffling their feet, or needing to hold onto walls or furniture for support. While many people attribute balance problems to aging or arthritis, vitamin B12 deficiency can cause a specific type of unsteadiness that affects your proprioception, your body's sense of where it is in space. Your spinal cord contains long nerve tracts that carry sensory information from your legs and feet to your brain, telling you exactly where your limbs are positioned and how to maintain balance. Vitamin B12 is essential for maintaining these nerve pathways. When B12 levels drop, the myelin coating on these spinal cord nerves begins to deteriorate, a condition called subacute combined degeneration. As a result, you may experience difficulty sensing where your feet are without looking down, problems with coordination, a wide-based gait where you walk with your feet far apart for stability, or frequent stumbling and falling. This can also lead to a positive Romberg's test, where you lose your balance when standing with your feet together and eyes closed. Interestingly, this type of nerve damage in the spinal cord can occur even before anemia develops, which means your blood tests might look relatively normal while your nervous system is already suffering damage. The danger here is twofold. Not only are you at serious risk for falls and fractures, but the underlying nerve damage may not fully reverse if the deficiency continues. Falls are one of the leading causes of hospitalization and loss of independence in seniors, and undiagnosed B12 deficiency could be a hidden culprit. This isn't the normal tiredness you feel after a busy day. This is an overwhelming, bone-deep exhaustion that makes even simple tasks feel impossible. You might feel breathless after climbing a single flight of stairs, need to rest after getting dressed, or feel like you're moving through thick fog all day long. Why does B12 deficiency cause such profound fatigue? Remember that megaloblastic anemia we discussed earlier? When your body can't produce enough healthy red blood cells, your tissues and organs aren't receiving adequate oxygen. Every cell in your body depends on oxygen to produce energy in the form of ATP through cellular respiration. Without enough oxygen-rich blood, your cells simply cannot generate the energy you need to function. Your heart works harder, trying to pump more blood to compensate, which can lead to shortness of breath and rapid heartbeat even at rest. Additionally, vitamin B12 plays a direct role in energy metabolism at the cellular level, helping to convert the food you eat into usable energy. Due to the breakdown of both oxygen delivery and cellular energy production, you're experiencing fatigue on multiple levels simultaneously. This can also lead to difficulty concentrating, memory problems, and that mental fog that makes thinking feel exhausting. Interestingly, many seniors with this symptom are misdiagnosed with chronic fatigue syndrome, depression, or even early dementia. Have you noticed blurred vision, dark spots in your visual field, trouble distinguishing colors, or a general dimness to your vision that glasses don't seem to fix? While many vision changes are attributed to cataracts or age-related macular degeneration, vitamin B12 deficiency can cause a specific type of vision damage that affects your optic nerve. The optic nerve is the cable that transmits visual information from your retina to your brain, and like all nerves, it depends on that protective myelin sheath we discussed earlier. When B12 levels are critically low, the optic nerve can become inflamed and damaged, a condition called optic neuropathy. Your optic nerve is responsible for sharp, clear vision and color perception. Without adequate B12 to maintain its myelin coating, the nerve signals become disrupted, leading to progressive vision loss that typically affects both eyes. As a result, you may experience central vision loss, where objects directly in front of you appear blurred or dark, color vision defects, particularly difficulty distinguishing red and green, or progressive dimming of vision that worsens over weeks or months. This can also lead to permanent vision damage if not caught early. Researchers discovered that B12-related optic neuropathy can develop even when other symptoms are mild or absent, making it a particularly sneaky and dangerous complication. The good news is that if caught early, vision often improves significantly with B12 treatment. However, once nerve damage reaches a certain point, some vision loss may be permanent. This is why any unexplained vision changes, especially in seniors with risk factors for B12 deficiency, should prompt immediate medical evaluation. Has someone you know become unusually irritable, withdrawn, or sad? Are they struggling to remember recent conversations, getting confused about familiar tasks, or showing signs of cognitive decline? Before assuming this is dementia or depression, consider that vitamin B12 deficiency can cause remarkably similar symptoms, and the deficiency is far more treatable. Vitamin B12 is essential for producing neurotransmitters, the chemical messengers that regulate your mood, memory, and cognitive function. Specifically, B12 is needed to produce serotonin, the feel-good neurotransmitter, and to process homocysteine, an amino acid that becomes toxic when it accumulates. Without adequate B12, homocysteine levels rise, serotonin production drops, and brain function deteriorates. Due to the breakdown of these neurochemical processes, you may experience depression, anxiety, or mood swings, memory loss, particularly recent or short-term memory, difficulty concentrating or making decisions, or confusion and disorientation. Interestingly, the memory problems caused by B12 deficiency can be almost identical to early Alzheimer's disease or vascular dementia, leading to tragic misdiagnoses. One study found that correcting B12 deficiency completely resolved dementia symptoms in some patients who had been diagnosed with irreversible cognitive decline. This can also lead to a condition called megaloblastic madness in severe cases, where psychiatric symptoms become prominent, including hallucinations, paranoia, or severe personality changes. If you or a loved one is experiencing cognitive or mood changes, especially if other B12 deficiency symptoms are present, insist on testing before accepting a dementia diagnosis. The difference between supplementing with B12 and accepting cognitive decline could be life-changing. You might notice your heart suddenly racing while you're sitting quietly, feeling palpitations or fluttering in your chest, or experiencing a pounding heartbeat that feels uncomfortable or frightening. While heart palpitations have many causes, vitamin B12 deficiency is an often overlooked culprit that places dangerous stress on your cardiovascular system. Remember that anemia we've discussed? When your body doesn't have enough healthy red blood cells to carry oxygen, your heart must work significantly harder to deliver what little oxygen is available to your tissues and organs. Your heart is responsible for pumping blood throughout your body, and when oxygen-carrying capacity is reduced, it compensates by beating faster and harder. As a result, you may experience tachycardia, a resting heart rate above 100 beats per minute palpitations, or a sensation of your heart pounding shortness of breath, especially with minimal exertion or chest discomfort. This can also lead to increased risk of heart failure if the deficiency continues long-term, because your heart muscle is working overtime every single day, never getting the rest it needs. Researchers discovered that people with untreated B12 deficiency have elevated levels of homocysteine, which not only affects brain function, but also damages blood vessel walls, increases blood clot formation, and raises the risk of heart attack and stroke. If you're experiencing unexplained heart symptoms, especially combined with fatigue, pale skin, or neurological symptoms, B12 deficiency should be investigated. Your heart is sending you an urgent message that your body desperately needs more oxygen-carrying capacity. This symptom often flies under the radar, but it's a significant warning sign. You might notice food getting stuck in your throat, needing to swallow multiple times to get food down, coughing or choking while eating or drinking, or a sensation that something is lodged in your throat even when you haven't eaten. Why does B12 deficiency affect swallowing? Your esophagus, the tube that carries food from your mouth to your stomach, is lined with rapidly dividing cells and is controlled by precise nerve signals. Vitamin B12 is essential for both the healthy turnover of these esophageal cells and the nerve function that coordinates the complex swallowing process. Without adequate B12 hours, the esophageal lining can become inflamed and the nerves controlling swallowing can malfunction. Due to the breakdown of both tissue health and nerve coordination, you may experience dysphagia, the medical term for difficulty swallowing, increased risk of aspiration, where food or liquid goes into your airway instead of your esophagus, or esophageal spasms that cause pain or tightness in the chest. This can also lead to weight loss and malnutrition, because people with swallowing difficulties often begin avoiding food, especially meats and other protein sources that are more difficult to swallow, which ironically are often good sources of B12. Interestingly, some people with B12 deficiency develop a condition where their esophageal muscles weaken, creating a pouch that traps food. If you're experiencing swallowing difficulties, especially combined with tongue changes or neurological symptoms, B12 testing should be a priority. Difficulty swallowing can lead to dangerous complications like aspiration pneumonia, making this a symptom you absolutely cannot ignore. Have you noticed that cuts and scrapes seem to take forever to heal? Are you catching every cold and flu that goes around? Do you bruise easily or notice that wounds become infected more often? These seemingly unrelated symptoms all point to the same underlying problem. Vitamin B12 deficiency is compromising your immune system and your body's repair mechanisms. Vitamin B12 is crucial for producing white blood cells, the soldiers of your immune system that fight off bacteria, viruses, and other pathogens. It's also essential for DNA synthesis, which means every time your body needs to create new cells to heal a wound, fight an infection, or replace damaged tissue, it requires adequate B12. As a result, you may experience frequent respiratory infections, urinary tract infections, or skin infections. Wounds that take weeks longer than normal to heal, increased susceptibility to illness, or unusual bruising from minor bumps or pressure. This can also lead to anemia-related complications. Because remember, you're not producing enough healthy blood cells overall, and that includes the platelets responsible for blood clotting and the white blood cells that prevent and fight infection. Researchers discovered that B12 deficiency can reduce the number and effectiveness of natural killer cells, a critical component of your immune system's first line of defense against cancer cells and virally infected cells. If you've noticed that your body just isn't healing or protecting itself the way it used to, and you have other signs of B12 deficiency, your immune system may be crying out for this essential nutrient. The typical dosage for treating deficiency ranges from 1,000 to 2,000 micrograms daily for oral supplements or 1,000 micrograms weekly for injections. But your doctor should determine the right dose for your specific situation. Here's how supplementation helps. It rapidly restores depleted B12 stores in your liver. It provides a consistent, reliable source of this essential nutrient that doesn't depend on your digestive system working perfectly. It can halt the progression of nerve damage and in many cases reverse neurological symptoms if caught early enough. Interestingly, vitamin B12 is water-soluble, which means excess amounts are excreted in urine rather than building up to toxic levels. This makes high-dose supplementation very safe for most people. However, always work with your healthcare provider to monitor your levels and adjust your supplementation as needed. Some people need lifelong supplementation, especially if the underlying cause of deficiency cannot be corrected. Even if you're eating B12-rich foods and taking supplements, you need to address why your body isn't absorbing B12 properly in the first place. This is crucial for long-term success. Review your medications with your doctor. Metformin, commonly prescribed for diabetes, significantly reduces B12 absorption. Proton pump inhibitors and H2 blockers for acid reflux reduce stomach acid needed to extract B12 from food. Certain antibiotics and medications for seizures can also interfere with B12 metabolism. Your doctor may be able to adjust dosages, switch medications, or add supplementation to compensate. Manage digestive health conditions. Conditions like Crohn's disease, celiac disease, bacterial overgrowth, or atrophic gastritis all impair B12 absorption. Working with a gastroenterologist to control inflammation, treat bacterial overgrowth, and heal your gut lining can dramatically improve your B12 status. Support stomach acid production naturally. As we age, stomach acid production declines, but you can support it by eating smaller, more frequent meals, chewing food thoroughly, consuming bitter foods like arugula or endive before meals to stimulate digestion, or considering digestive bitters, or betaine HCl supplements under professional guidance. Here's how addressing these root causes helps. It doesn't just treat the deficiency, it prevents it from recurring. It improves absorption not only of B12 but of other essential nutrients like iron, calcium, and protein. It reduces the doses of supplementation you might need long-term. If you've been diagnosed with pernicious anemia, an autoimmune condition, where your body attacks the cells that produce intrinsic factor, you'll likely need lifelong B12 injections, but managing other digestive issues can still optimize your overall nutritional status. Vitamin B12 doesn't work in isolation. To maximize nerve repair, cognitive recovery, and energy restoration, you need to support B12 with its nutritional partners. Focus on these key nutrients. Folate, the natural form of vitamin B9, works hand in hand with B12 in DNA synthesis and nerve function. Food sources include dark leafy greens like spinach and kale, legumes, asparagus, and Brussels sprouts. Avoid folic acid, the synthetic form. In isolation, it can mask B12 deficiency while nerve damage continues. Vitamin B6 is essential for neurotransmitter production and works with B12 to lower homocysteine. Good sources include poultry, fish, potatoes, chickpeas, and bananas. Magnesium supports over 300 enzymatic reactions, including those involved in energy production and nerve function. Consume pumpkin seeds, almonds, spinach, dark chocolate, and avocado regularly. Omega-3 fatty acids, particularly DHA, are structural components of nerve cell membranes and myelin. Eat fatty fish like salmon and sardines 2 to 3 times per week, or consider a high-quality fish oil supplement. Vitamin D supports both immune function and calcium absorption for bone health, crucial since B12 deficiency increases fall risk. Get sensible sun exposure and consider supplementation, especially in winter months. Here's how these nutrients help. They accelerate the repair of damaged myelin sheaths around your nerves. They support the production of new, healthy red blood cells. They enhance cognitive function and mood regulation. They reduce inflammation that can worsen nerve damage. They provide the complete nutritional foundation your body needs to heal comprehensively, not just in isolation. Try to get these nutrients from whole food sources whenever possible. A Mediterranean-style diet rich in vegetables, fruits, fish, nuts, seeds, and olive oil provides an excellent foundation. However, for those with severe deficiency or absorption issues, a high-quality B-complex supplement that includes all the B vitamins in their active forms can be beneficial. Now that you understand these 10 visible warning signs, it's time to take action. If you recognize 2 or more of these symptoms in yourself or a loved one, I strongly recommend scheduling an appointment with your healthcare provider for a complete B12 evaluation. This should include not just a standard B12 blood test, but also methylmalonic acid and homocysteine levels, which are more sensitive markers of B12 deficiency. Your doctor may also recommend a complete blood count to check for anemia and other diagnostic tests. It's important to understand that B12 deficiency exists on a spectrum. Early-stage deficiency might cause only subtle fatigue or mild tingling. Moderate deficiency brings more noticeable anemia, neurological symptoms, and cognitive changes. Severe, long-standing deficiency can cause permanent nerve damage, serious heart problems, and irreversible cognitive decline. The key is catching it early, before permanent damage occurs. But here's the encouraging news that should give you hope. Your body has a remarkable capacity to heal when given what it needs. Your bone marrow can quickly begin producing healthy red blood cells again. Your nerve cells can repair their myelin sheaths, restoring sensation and function. Your energy, mental clarity, and mood can dramatically improve. While some nerve damage may be permanent if deficiency has been severe and prolonged, many people experience significant, even complete, reversal of symptoms with proper B12 treatment. Your body wants to heal. It's just waiting for the tools it needs. So let's talk about 4 powerful ways to restore your B12 levels, protect your nervous system, and reclaim the health and vitality you deserve. The most bioavailable and easily absorbed form of vitamin B12 comes from animal sources. Your body can use this form of B12 immediately without any conversion. Focus on including these foods in your diet. Beef liver and organ meats, which contain exceptionally high amounts of B12 with just 3 ounces of beef liver providing over 1,000% of your daily needs. Fatty fish like salmon, trout, sardines, and mackerel, which provide not only B12 but also omega-3 fatty acids that support nerve health. Shellfish, especially clams, oysters, and mussels, which are among the richest food sources of B12 available. Eggs, particularly the yolks, dairy products like milk, yogurt, and cheese, and poultry and red meat in moderate amounts. Here's how these foods help. They provide B12 in its natural methylcobalamin and adenosylcobalamin forms, which your body recognizes and absorbs efficiently. They supply the cofactors and nutrients needed for B12 metabolism, including folate, vitamin B6, and minerals. They support your overall nutritional status, providing protein, healthy fats, and other vitamins that work synergistically with B12. Try to consume B12-rich foods at least once daily. For seniors or those with absorption issues, eating smaller amounts more frequently throughout the day may improve absorption. If you're vegetarian or vegan, this becomes even more critical. You'll need to rely heavily on fortified foods and supplements, which we'll discuss next.